Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. If you want to know how to help athletes return to sport before they're ready, you have to tune into this episode. Before I go on to the podcast, what is new? What is better? One of the best feelings on the planet for those who have kids. So I was in Florida this week for an event, and I came back and I fell asleep, and my kids will somehow sneak into my bed, and they uh, they woke up, they came in, and they were so excited, and all I could say was, Dad, we missed you. My daughter was like, Daddy, that is, that is one of the most amazing feelings on the planet. If you're a parent, you understand that. If you don't have kids, that's what you have to look forward to. Somebody asked me recently actually at the conference, they said, what are you most excited about when you go home? I said, um, to have somebody just, so excited to see you. Like for those who have a dog or a pet and don't have kids, like that's the feeling, right? Like somebody's so excited to see you when they come in the door. That to me was what I was looking forward to come home. So the event was fantastic. It was great. Kids are obviously ecstatic, and trying to navigate now how to get my wife on a date coming up. So I have a couple events coming up. I have the barbell course this weekend for those of you listening to the podcast in October of 2023. I have the barbell course this Saturday and Sunday for those who are interested in joining at the last minute, virtual or in person. drchrisgarcia.com/barbell. Love to have you in there. And I've never done this. If you mention the podcast, send me an email, drchris@drchrisgarcia.com. If you mention the podcast, I'll make sure you're taken care of. I can get you some savings on the course. Let me know. But other than that, I'm working already on those who want to take my Kickstarter course in January. It's an 8-week course, working on that. And then just planning out for a major event next year. So I'm looking forward to that. All right, on to this podcast. What am I talking about? When athletes are before they're ready. So this comes from a conversation that I had with some team members, and we were talking and navigating a return to sport scenario that is definitely not ideal. And I put in the title of this podcast, before people are ready, before they're ready. Now they're willing, like they'll do it in non-ideal circumstances, but by definition, when we would classify them as ready, they have 90% of scores, they have strength, they have they don't have atrophy anymore. Their subjective report is 100%. When they're ready is very different than they're willing to do, and they're safe to do, but not ideal. So we navigated a case, and I want to share what is the framework. How do you navigate these? Because it's a challenge that all PTs face, and you don't have confidence. You're like, what happens in this scenario? What should I do here? And I'm going to outline 3 simple steps to be able to help you navigate these cases. It'll help you frame anything that is thrown at you, whether that's a post-op or a non-operative or a fracture or whatever it is. You can put this framework into, is this person safe to go back? And what are things that I'm missing that could make this worse? And how to present it so to the patient, to the athlete, so that you don't feel guilty. You don't feel like you're the one who's ruining their career, their athletic career, or their dreams to do this. And so whether that's a 5K or a Super Bowl or a soccer match or a high school lacrosse game, you can insert this framework, and it'll help you make a decision, which is actually the hardest thing for PTs to do, is commit to a decision on how confident and comfortable they feel giving a prescribed or a recommendation on how likely this person's going to get better. And I'll share that today. So that's why I created this episode, really from a fantastic conversation that I think that all of you out there will benefit from. So let me give you a scenario. Let's talk about an athlete. Let's talk about an athlete case. Let's say you have a soccer player, and that soccer player is just had an ankle sprain, and they're 3 weeks out from a big match, and you get them at day 21 days from the match, and you're at day 0, right? So now the athlete comes to you inside your clinic, and you happen to, they get a same day appointment with you, and they don't want to go to their primary care physician. They don't want to get x-rays. They don't want to do urgent care, and they trust you. That's beautiful. All right. So the next question is, how do I know if it's possible to make it back to the field in 21 days? Now, from a soft tissue healing perspective, it would tell you, well, it's going to take 4 to 6 weeks. But from a willingness, this athlete wants to return. Now you have to question, all right, well, what's safe, what's ideal, and are we able to do this? So I'm going to take this soccer athlete as the case and keep this in mind. So let's take a grade 1 athlete who this is a high schooler, and they stand in class and they present in crutches. They walk all through campus and they sit for the majority of their classes, and they present to you with crutches. And your goal now is, in 21 days, get this athlete to return to be a midfielder, which is a lot of cutting and pivoting. And all they want to do is be able to play in this game. Your job as a physical therapist is not to create the exercises, not to create the stretches and the parameters and all of those things. Is now, can you decide or determine if this person is able to return to play in 21 days? So here's how I'm going to frame it. You ready? All right. The first step is determining whether this a baseball player or a football player or a soccer player, like we're presenting here. You have to determine the gap, the difference in the potential. So what I mean by that is, don't start going to the fancy exercises. Don't go to the stretches. Don't go to any of those things. What you're going to do is you're going to determine what is the gap between what they want and expect and their current situation. So let's determine the gap, right? So if it's a post-op ACL and they want to go back to tennis, you now have to figure out, okay, what's the anticipated date that you want to return, month 9, and your current status. Now that gap will determine how possible this is. So for in this case, we have a soccer athlete who has a 3-week-old ankle sprain. So what do you do with this ankle sprain 21 days out? And that's where they want to be able to compete in 0 days of injury. Here's the challenge you have to determine. I said you have to find the gap between what they expect and what they want. Now, what you have to figure out is, what do they expect? Do they expect to be at 100% playing in 21 days? I think you have to establish that. And that's where PTs were hesitant. It's a big part of what we skip. You have to ask, okay, great. I understand you want to go back to play, but you have to get a numerical expectation of, it's an objective measure. All right. How many minutes do you anticipate playing? At what intensity or effort? You have to get something objective. So I like percentages because it's all subjective to that person. So I say, what percent do you expect to be at in 21 days? Now, I'm going to provide it from a healthcare perspective, but in an ideal scenario, now you have to admit 100% would be very difficult. What would make you feel good enough to participate? What do you think you'd be safe at in your own rating scale? Now, what it allows them to do is understand, okay, ideal is 100%, but not possible in this scenario. So what would they be okay with? That's something that no one has brought to them. What would you be okay with? What perceived effort, what percent improvement would you be okay with and safe to go to sport? Not from a medical side, but from a confidence standpoint. I say, well, I guess like 70%. Okay, so now that gap is they're at 0% now and 70%. What we've established is, I don't expect you to go up to 100% plyos, single leg hops, running full speed and turning and pivoting at 100%. So now we're talking about, okay, great, we've established that. Can we get to the 70 is the question, because that's the gap. But most clinicians, we're obsessed with 100%. We're obsessed when in reality, nobody cares about 100. You and I would be okay walking around at 80, 90% with less pain, but able to function. But the problem you go into 100% is because that's how insurance has like made us, right? How close to 100% and 90%, they have to be within this. But what if you don't have that? And that's where PTs struggle. Why? Because you took me out of my comfort zone. Why? I've always had the opportunity to talk about 100%. That's my target. I get it to 100%. But when you work in a scenario where that's not possible, and this is where I loved working with athletic trainers in different settings and sports PTs and performance facilities that you work with strength coaches and everybody else who's dealing with the non-ideal. Why? Because you always work with the non-ideal. You don't always have ideal. In the clinic, you have ideal regularly. And that's the difference between a clinical mindset and a sports PT mindset. A clinical mindset is 100%, got to prove it, 90%, objective measure, pain measure. Forget that. Get that out of your head. Because when you have a non-ideal scenario, you can't apply ideal qualifications onto a non-ideal scenario. It's not possible. So you have to work with what you have. So you figure out what the gap in their expectations, true expectations, and 0%. Now we figure out, can we get to 70%? That's where the problem lies. So number two, once you've established that, I have some notes here. Okay. Now you have to figure out good, better, best. Now I've called this plan A, B, and C. Now for a consumer, it's nice to know what's the best case scenario, what's a good scenario, and what's even a better scenario. Okay. So let's just categorize them. You ready for this? 70% is what they expect. That would be good, better, best. That'd be the best case scenario. 70% return to sport. Now, that means you might not feel comfortable with cutting and pivoting. You might not play the whole game, but you're playing at 70% effort with intermittent intervals. Maybe you can play the second half or the first half or whatever it is. Now you have some modifications. So that's best case scenario. Now we have modifications with cleats, a brace, time, total time played, perceived effort. I mean, all these variables, but that's the best case scenario. And they're like, oh, I can do that. Okay, great. So once we've established best, we now have to look at good and better. What would good be? Well, maybe I only get you to 50% and you can only play 10 minutes. And you're going to have some pain. And they're like, gosh, I don't like to hear that, but at least I get to play. So that would be worst case scenario. So we're going to call it good. Why? Because it's a positive thought. It gives them a better mindset of what's possible. So don't say worst case scenario. It's like, this is the good. This is the best. And now somewhere in the center is better. So now I turn somebody's situation into a possibility. And that's the difference. When you have somebody, I titled this, how to help an athlete go back to sport when they're not ready. This person's not ready at 100%. They're not ready, but they're willing. So then the question is, giving their willingness, how do I determine how to get there? Number one, determine the gap and what they expect and where they're currently at. Got it. I've established that. And that's where most PTs go wrong, because you think it's 100%. So we 70%. Great. Now we figured out good, better, and best. Good is 50%, a lot of modifications, it hurts. Best is 70%, minimal pain, struggle with multi-directional, but able to participate half the game. Oh, perfect. So somewhere in the middle is 60%. You'll play 60% of the game. You'll be able to do most things. You might have a little pain, might have a little discomfort. You'll be able to twist and turn, but it might be uncomfortable. Are you willing to do this? That's not my decision as a PT to make that call. So if once you've determined the gap, you've now created good, better, and best. Lastly, we haven't decided on the exercises. The last step is establish a way to expedite healing. First part was determine the gap. Number two, establish good, better, best. Number three is establish ways to expedite healing. That's an interesting question. We normally think about alleviating pain. I'm asking you to expedite healing. How do you expedite healing? That's an interesting question. What would you do with your patients and athletes to expedite healing? And no, this is not an exercise. This is, are there ways to minimize stress so that they can heal faster? Not, we always think in terms of like expedite healing in terms of like, what are we going to do? Class 4 laser? What are we doing? No. Minimize the stress because that would improve healing because you have less stressors going to it. So in this case, you'd probably put them in a brace, whether you believe in bracing or not. You go anti-inflammatory, ice, all the normal stuff that if you go pro-inflammatory, anti-inflammatory, take your route. And then how about you either put them in a boot, put them in a brace, put them on crutches. They're not allowed to jog, walk, run. They're allowed to only bike for the first week. They're in a scooter. That'd be great. Move them in a scooter so that way they have less stress going through that, minimize the aggravations. Are they using tape, elastic tape, kinesio tape, Band-Aid, whatever you want to call it, like whatever magical tape you want? Taping, bracing, soft tissue work, ice, e-stem, laser, scooter, total time standing, total time walking, controlling all these variables. Now, what's crazy is we just mapped out how to get somebody back to sport, even when they're not ready, but they're willing, without even starting treatment. All we did was figure out the difference between what they expect and want, where they're currently at. We created good, better, and best situations, then figured out, is there ways to expedite healing? What can they be doing at home? Are they working on a brace? Do they have tape? Are they in a boot? Are they in a scooter? Are they standing most of the day? How are they going to maintain their fitness? They've got ways to, work on the bike. And once you set these three things, this is it. Set these three things. Now you're in a position to be able to help somebody get back to sport when they're not ready. The irony of all this is we've done all of this. You can create this without even putting your hands on them, without even doing a single mobilization, without even doing a single corrective exercise. This outline is a bare minimum outline, but at least they have direction. Now, let me outline what a lot of typical orthopedic PTs might do. Great. Let me take some range of motion measurements. Let me take girth measurements. Let me see how much swelling you have. And I'm going to look at your strength, your MMTs. That's painful with eversion, painful with inversion, tentative palpation. Yep. And your gastroc is definitely not strong. You have antalgic gait. Great. Those we can all help. So now I'm going to have you come in 3 times a week so I can help you reduce the edema. Well, how long is this going to take better? Says the athlete or patient. You don't internally, PT says, I'm afraid to commit and I don't want to overpromise. Well, we're going to take it week by week and we're going to see where you're at on Monday and we'll push you then. We'll see how it goes. Okay. Client or patient or athlete says, that kind of sucks. I guess he can't tell the future. So it's not his or her fault. So, okay, that's fine. I'll just come back next week. Then patient shows up second week. Oh, you're looking fantastic. Your range of motion is great. Oh, you have more swelling and you're still tentative palpation. Athlete says, yeah, I've been standing all day and I've been walking on it. Oh, PT says, you shouldn't have been doing that. You know what? It's going to delay your healing. First of all, that's your fault, PT. Don't you ever blame that on the clinician or the patient. That's your freaking fault. Your job is to reduce stressors. And anytime that somebody gets worse, it's your fault. Why? Because you should have told them that. Now, if you told them that, give them all the guidelines and you wrote it down for them, and they have something to be accountable for, then it's their fault. However, your fault for not outlining it. I hate when patients have horrible outcomes and the PT is like, oh, that patient didn't listen. It's your effing fault. Your fault for not setting the outline. It's your job to forecast the future. Why? Because you treat people every day, day in, day out. You probably treat thousands of people a year. You can't tell me you didn't identify that trend. It's because you didn't package it right and you failed to deliver on something that they could have simply done on their own. All right, that's a different scenario. Second week is still around. Patient says, "Hey, I'm a week away from my game. Do you think I'll be able to practice next week?" And they're like, "Oh, let's just see how you come in next week." PT is afraid to commit to something, so they don't want to overpromise. And let's just ignore it and talk about it later. Don't worry, patient. Let's just come in next week. You're looking fantastic. Your walking is so much better. We'll see how you do on next Monday, 5 days out from your game. Third week comes around. Patient now has minimal swelling, a little bit of tenderness palpation. And then PT says, you know what? Let's start plyos. Let's just magically start plyos and test you on running, because you know what? Your game is this week. Patient flares it up now because you tested them. It's worse, and they're flared up. PT says, that's a tough scenario, kid. It doesn't look like you'll be able to play, but at least you'll be able to watch and support your team. Look at the difference between the scenario I set up from the very beginning, or this horrible example of patient care as an example. The first scenario, I outlined what was possible. I provided bumpers on good, better, best, and I gave them ways to mitigate any worsening. I provided the best healing environment. That's what I did. Scenario B, orthopedic PT says, we're going to take it week by week. I'm definitely not going to look at planning this out because I don't want to commit. And I'm going to take it session by session and hope you get better. And I'm going to target and work on the range of motion and strength, which is going to tell me if improvement, which doesn't tell you improvement. It just tells you that you weren't mapping this out for this person. It just tells you how horribly you failed. Now, if you map this out for somebody and they don't listen, then we're putting it on the patient. Now, how to get somebody back to sport when they're not ready? You outline it for them. You provide the best freaking healing environment. Get it set up so they know what the route is. They know good, better, best. You know what the difference in the gap is. And you know things are going to make it worse. Then, ready, best case scenario, you blend my scenario and my framework with your magical way of healing, your mobilization, your manual therapy, blah, 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 all the things you get certifications for, right? Use the alphabet soup to get them out of pain. Use my framework to maximize the healing environment so they're set up for success. They know the maps. They know how to not flare it up over the weekends or in the night or at school, and not walk on crutches, to work with all these things. Your goal is to set up the best healing environment. And right now, the PT framework just doesn't work for the PT framework does not work for non-ideal situations. The PT framework does not work for non-ideal situations. Why? Because we're not used to non-ideal situations. We're used to very classic, you have a hip replacement, you can forecast and take your exact time. And that's why you're a magical PT, because you don't have any timelines. But if you have a timeline, that's where it becomes crunch time. And what you do naturally is you just say, let's just see how it goes. Let's just take our time. Let's just not mess it up. Don't risk it. Or have the audacity to frame it out and make some mistakes, but communicate that it's not ideal. Here's a scenario. They can choose. And once you allow them to have a choice, you move from therapist to coach. This is a great conversation I had with my team. And what's the difference between a therapist and a coach? Say you go to counseling or whatever it is, a therapist and a coach. A therapist provides solutions for you to implement. A therapist provides solutions so you can get better. A coach guides you so you can make the best decisions with the information that you have. A therapist tells you what to do, and a coach shows you how to do it. So a therapist is essentially not creating independence, creating dependence, just providing you solutions, not teaching you how to think. And a coach helps guide you to improve your thought process, to help you make better decisions with good, better, best. Here's the scenario. Which one do you want to do? versus a solutions focused person is, here's the exercises, here's exactly how many times you need to come in. I'm not going to give you the forecast. I'm not going to give you anything that you can do better or worse at home. I'm just going to tell you what to do day by day, week by week, session by session. Yet clinicians say we want to create, independence, and the patient can get better in 3 visits. Impossible. You're just being a therapist, which is you're just providing solutions. You have no long-term benefit, versus guiding them and giving them a map, good, better, best, helping them create situations, knowing that they can make the decision for themselves. Which options do they want? So you're a therapist, you're a coach. Do you guide or you fix? If you're a fixer, they always need your help, which is dependence. If you can guide people to make decisions on their own, that's independence. So are you doing the right or wrong thing? That's a whole separate podcast that I'll do on its own. But nonetheless, in order to get people back to sport when they're not ready, you have to create the best healing environment. In order to do that, find the gap between what they want and expect and what they're currently having. Present good, better, and best options, and establish ways to expedite healing. Once you do that, add your flair, add your all of the little things that you want to do. I could say people are their own chefs. They can create the meal, or they can create this experience or this opportunity for people to be successful. Once you do that, you have the ideal scenario for healing. And that's the difference between phenomenal clinicians and average clinicians. I'll let you choose which one you want to be. So there you have it. This is what I do with all my athletes, all my patients, all the PTs that I mentor. This is the framework that allows them have the best chance of success. And I do this a lot with, I've done it with all types of athletes. I do it with barbell athletes. I do it with soccer athletes. I do it with everybody else, and it works. And the reason I created my management of the barbell athlete course was because it feels like a separate group of athletes. They're CrossFitters or Olympic weightlifters, whatever it is. The framework is the same. You're just adding it to these type of athletes. So if you work with high intensity athletes, you work with athletes who do F45, Orange Theory, which they don't categorize into one specific sport, or they're bodybuilders, or they touch a barbell. Nonetheless, they're a barbell athlete. And so if you're looking for ways to manage patients who happen to touch a barbell, you need to attend my management of the barbell athlete course. I'll show you this framework. I'll share it all. And again, that's this weekend, October 28th and 29th, 2023, whenever you're listening back to this, and they'll set you up for the most success possible. So there you have it. I'm excited to see you virtually or in person at my course this weekend, and give you the best chance of success in your career path to maximize the outcomes and stop going in circles, doing the same thing over and over again and hoping that it changes. So there you have it. I hope you guys are doing well and absolutely crushing it. And I will see you guys on the next episode. Take care.